I'm very pleased to record a short message about a case that I was instructed by Devonshires to act on behalf of the claimant. The matter was against a local NHS authority. The claimant had a history of hip pain, which had gone back to around 2010. She'd initially sought some assistance from her GP, but that hadn't helped. So eventually she was referred through a series of referrals to the orthopaedic team at this local hospital, where she was initially seen, examined, and no specific diagnosis at that stage was made. What happened was a suggestion to then go off and have some physio, which she did, and a cortisone injection. None of that helped, and as time went on, it appeared that there was no real solution in terms of her problems. So she next underwent an MRI scan, and that seemed to show that there was a reasonable presentation in terms of the hip, and there was a small amount of degenerative change. The degenerative change on the scan was described as being very modest. The surgeon decided that the appropriate way to go forward would be for her to have an injection, both of a diagnostic basis to understand whether or not that was where the pain was coming from, and also on a therapeutic basis to try and relieve that pain. And therefore, the claimant was put on a waiting list to have an injection in order to try and see whether she could be helped and what exactly was going on. The problem that arose in this case is that at some point, and it's still unclear when, that injection was cancelled. And as a result of which, the client ended up proceeding to go to hospital, thinking she was having the injection, but actually when she arrived, being told that she was going to have a total hip replacement. The claimant, at the time, to set the scene, was concerned about pain, which had been ongoing, and did, as many people do, think that doctor knows best, and therefore followed the advice and simply signed the document and went ahead and had the total hip replacement. Beyond having the hip replacement, unfortunately for her, her symptoms did not improve. Indeed, they deteriorated somewhat, and she maintained pain and maintained problems which were ongoing for some time. And it was at that stage that she came to see us in order to try and understand what had occurred and why she still had significant pain, and whether or not she had been indeed treated properly. Now, of course, the standard of care that a claimant in these sorts of cases has is that they have to be treated to a reasonably competent standard. Our expert orthopaedic surgeon took a look at the medical records and was instantly struck by the fact that she had been suggested and then agreed to have an injection, and this was going to be an X-ray guided steroid injection in order to see what was going on, and that never happened. And when it was queried and looked further on, it appeared that at no stage following this cancellation had the claimant been told that she wasn't going to have this injection, and she turned up to hospital thinking she probably would. In looking at what had happened, it appears that somewhere down the line the hospital had indeed cancelled the injection, and either that message hadn't gone back to the surgeon, or it had, and the surgeon simply didn't decide that anything needed to happen. As a result of which, she underwent the operation, and in the view of our expert, it was totally unnecessary and should not have taken place. And the evidence around that was, first of all, he said that the scan did not show any significant damage or problems with the hip. Certainly the level of osteoarthritis within the hip was not that which you would go off and have a total hip replacement. And secondly, he said, well, you'd have to look at why the pain is there and work out what the source was. And that really was a mandatory factor. It wasn't something optional. It wasn't a potential that you could, but a different body of surgeons would do it this way. He was very clear that she needed to have this injection in order to work out whether that was the right treatment. We therefore proceeded on the basis of bringing a claim saying that there had been negligence, and the negligence, the breach of duty, was that no reasonable competent surgeon would have proceeded to a total hip replacement without understanding what it was and why they were doing the total hip replacement, and in this case, without having the diagnostic injection to try and work out whether or not that indeed was the source of the pain. Clearly, it wasn't the source of the pain, and we said on causation, had she have had the diagnostic injection, that would have made clear that it wasn't the source of the pain, and therefore she would not have proceeded to have the total hip replacement. The defendants denied liability, and they stated, first of all, that the claimant herself was responsible for cancelling the appointment, and second of all, they said, in any event, it made little difference in terms of what should have happened because she required a total hip replacement, and that when the surgery took place, the report and the record said that the osteoarthritis, the degeneration within the joint, was significant enough that they should have, at that stage, that would have mandated surgery. That was something which the experts in the case, the defendants, of course, had their own expert, the defendants' expert and our expert, the claimant's expert, had a significant disagreement about, with our expert saying and being very clear and robust that this was not a hip which should have been operated on. The reality is, although there was a significant and robust defence from the defendants as to whether or not it was reasonable for them to act as they did, ultimately they did agree to mediation and to come to a joint settlement meeting. At that meeting, a number of discussions took place around what had occurred, but whereas at the start of the meeting the defendants maintained their position on liability and breach and stated that really they had no offers to make, by the time we'd gone through the evidence very carefully and looked at the various records, the defendants did accept that on balance they were likely to fail in their claim, and they decided that they would start and make offers. Suffices to say that during the course of the negotiations, we managed to achieve a very substantial settlement for the claimant, compensating her both for the pain and suffering that she'd gone through in the period of time following the operation where she had unnecessary post-operative pain, but also looking at her special damages, her loss of earnings that she had missed when she had not been able to work, the care and support that she had in the aftermath of the surgery, and the fact that because she'd now had an operation, a total hip replacement, she would need to have another one in the future, and the private costs of that and any care thereafter were also included in the settlement. So all round, a very good result for the claimant. The matter settled approximately 2 months before it would have gone to trial, and the claimant was very pleased with the result, and indeed we, as her legal team, were very pleased indeed with the result as well.